causes of hepatomegaly. Now overall you can have a clinical classification and you can also have an etiological classification. Etiological classification will have many causes, but clinically if you are able to remember that it could be tender or it could be non-tender, that will help you analyze what are the probable causes you are dealing with. Usually tender hepatomegaly is because of hepatitis. It could be because of abscess. It could be sometimes because of rare vascular conditions like say Piliosis hepatis. Piliosis hepatis. Okay, and it could also be because of conditions where there is congested liver, like congested liver, like Budd-Chiari syndrome, or it could be right heart failure. Okay, these are the conditions where you are going to get tender hepatomegaly. Causes of non-tender hepatomegaly are many. We will just remember at least as diagnosis. It could be cholestatic liver diseases, cholestatic liver disease like PBC, PSC, secondary biliary cirrhosis. Okay, secondary biliary cirrhosis is where when the biliary duct or tract is obstructed over chronically due to some cause, there could be secondary biliary changes in the liver which usually can present as hepatomegaly. Okay, then there could be mild tenderness also. Then it could be storage disorders. Storage disorders could be storage which can vary from lipid storage. It could be conditions of glycogen storage. Okay, it could be Gauchers. There could be α₁-Antitrypsin deficiency where there is accumulation of some compounds in the liver like α₁-Antitrypsin deficiency. There could be hemochromatosis and Wilson's disease. Hemochromatosis or Wilson's disease. Common cause for lipid accumulation is what you now call as NASH or MASLD, or it could be alcoholic liver disease also. So these are causes for lipid accumulation, and sometimes the lipid accumulation could also be because of genetic conditions. I'm not getting into too much depth now. There could be infiltrative disorders. Again, infiltrative disorders. Now, infiltrative disorders could be benign infiltration that can occur, or it could be malignant like HCC or cholangiocarcinoma, or it could be metastasis. These are non-tender causes that can present to us. Sometimes even presence of space occupying lesions which could be there and cause these kind of symptoms. There could be cystic lesions, non-tender cystic lesions which can similarly present, like example Caroli's disease. It could be polycystic liver disease, polycystic liver disease. Okay, so these are all causes. How we can divide it as tender hepatomegaly and non-tender hepatomegaly. Okay.